Good afternoon, everyone. Welcome back to another episode of Mind Split Cafe. My man, Matt, what's going on today, sir?
What's going on, good people? How are you? And we got a great guest this week. I can't wait for you to introduce
Yeah,
who
we
we've
got a
got
Valley
this
native.
week. Yeah, Valley native. Yeah.
This is going to be a good one. So, Dr. Hughes, how are you doing here? Or, sorry, how are you doing today? And do you want to introduce yourself and kind of let the viewers know what we're going to be talking about today?
Sure, absolutely. So my name is Velma Hughes, and I'm a psychiatric nurse practitioner with my doctorate degree. I've been practicing for about 7 years in the mental health field, but as a psychiatric registered nurse, I've been in this population or the focus for about 22 years. So I've been living in the Valley my whole life and have a privately owned clinic here in Harlingen, Texas. So
So, before we start, I got to ask, you grew up in the Valley. What high school did you go to?
San Benito, I'm a Greyhound.
I'm a Sherryland Rattler.
Well, I'm a Bronc, so
Yeah, that's a little different, but it works.
yeah. No, but Dr. Hughes, I grew up in the Austin area, but I came down, like I was telling you off air, I came down to play basketball at Pan Am in '96. And so I lived down in the Valley after I got done playing, I stayed down there, and I love the Valley. I love the people. I love it, and so I miss it. I miss the Mexican food.
Yes.
Don't we all? Don't we all? So,
That
Dr.
makes me
Hughes,
crazy when I say that. I mean, I'm talking.
no.
No, my brother's a psychiatrist in Austin, in the Austin area, and I go visit him and my mother and my sister. They're all in that area, Pflugerville, and so I cannot tell you how much I miss the Mexican food when I go visit, because you would think Austin has good Mexican food. It's too few and far in between.
Very much. Very much. I agree with that. I lived in Austin for almost 12 years, so I definitely know that there's a need there as well.
Yes.
Well, being in private practice, what kind of patients do you typically see? Or like, let's get into the kind of the nitty gritty and kind of
So
talk about.
yeah, absolutely. So I see it's family psychiatry. So anybody from 5 years of age all the way up, my oldest right now is 98 years old.
Wow.
And yeah, I see people, it's amazing because the population that has my clinic, up and running, the majority is professionals and doctors, lawyers, nurses, uh, licensed therapists, just people that you wouldn't think would come out and say, "Hey, I've got depression or anxiety," because of
Wow.
the stigma.
Yeah.
So
Yeah.
I'm glad that, they're now reaching out more and more, reaching out. Have a lot of veterans, Border Patrol,
Okay.
and so I see a lot of depression, anxiety. Those are the top two, PTSD and ADHD.
You know,
Um,
not to cut you off, but have you seen a certain like pivot or a shift in recent years since kind of mental wellness and mental health topics have been kind of front of mind, or they've kind of been pushed out in the media as far as like it's okay to not be okay. Have you
right, right.
have you seen a recent uptake or a shift, like that's when it all kind of started coming together, or has it always been the doctors and attorneys for the last decade or so that you've been in practice?
Yeah, so I've seen it was kind of weird. It was during the COVID, during the pandemic,
Mm-hmm.
2019, 2020, where it was more of the professionals that were staying at home, seeing patients, from their home office. We weren't able to get out and, socialize with anybody. So
Huh?
the depression started setting in, and I started reaching out to, local clinics and just trying to get in there and give them talks, to the staff about, it's okay to have this depression and to feel sad, and especially because you're not out in the sun, with that natural vitamin D. So once your vitamin D hormone, which it says it's a vitamin D, but it's actually a hormone. Once that hormone starts depleting, that depression starts kicking in, and it's a bummer. But yeah, during the pandemic, that's when I've noticed more and more people opening up, especially with this virtual type of visits.
Yeah.
Yeah, absolutely. And I want to pick your brain on that one. And Matt, this question's for you too. So do you think because they were able to do virtual visits, more people came to the realization, or maybe even just brushed off the stigma because they didn't have to go in person and they can do it from the comfort of their house and no one will know that, hey, they're walking into a mental health facility? Do you think that
Yeah,
played a role?
that's a good point. Like, oh, I spotted you going into, Dr. Hughes practice or whatever, what's going on. It was like that you could seek out that treatment and help without having that fear of kind of being found out, because you can
Right.
do it virtually. Yeah.
Right, right. Yeah, it's just like, that type of mindset is, I mean, with anybody. I went to go speak in a clinic. It was a local HIV clinic, and, just in my mind, I'm thinking, how many people are watching me walk in this building and,
Yeah.
wondering if I'm a patient or, something else. But yeah, the freedom of, having this visit in the comfort of your home. It's more of an intimate type, visit where
Mhm.
it's just, the patient and I, and
Yeah.
nobody else needs to know who you're talking to at that point in time. So,
Yeah.
yeah.
I totally see that. And going back to what you mentioned about the going into the HIV clinic, right? Like, you live in the valley. And
Right.
so the valley, it's kind of like everybody knows everybody,
Hmm.
it's got that small town, even though it's relatively decent in size. Everybody kind of knows everybody. Oh, that's so and so's cousin, or that's Dr. Hughes, or that I go to church with her, or whatever. So
Right.
there's that fear of, even though you were just doing, you know, you know, like you were giving a talk, there's still that fear of like, well, am I going to have to explain myself, right? And that
Right.
can kind of, I'm assuming that can kind of, maybe not with you, but with other people that are dealing with the same type of situation, that can lead to anxiety and a similar depression, correct? Like that could
Correct.
kind of trigger the beginnings of something like that. Would you agree?
Right. Right.
Yeah, that's a good point. I didn't even
Yeah.
think of that.
Yeah. So I just, I like I said, I love the valley, and I just know how it works. But I'm not just talking about just the valley. It could be in Minnesota, or it could be in, Austin, or, San Diego, or whatever. It could happen anywhere. But I'm just assuming that could definitely kind of be an early onset trigger for anxiety and depression.
Yes, absolutely.
Yeah.
Absolutely.
And off camera, speaking of kind of like a trigger for anxiety and depression, we were kind of discussing something that we were going to discuss either way, but I think this might be a good segue into it: the MTHFR gene.
Right.
So let's talk a little bit about that. I think that's
What is that?
a good topic. Yeah. First of all, what is it? Let's
Yeah.
start with that.
Yeah, so MTHFR is a gene that affects the body's ability to process folate. So there are at least 40 different mutations in this MTHFR gene, but there's I say the top three. There's three of them that are easily identified through saliva. You can get a genetic testing, and I think it's like $99 or something. We order them here in the office, but we don't do the billing or the pricing. But I think it's about $99. They send you a swab, you swab your mouth, and they let you know if you do in fact have this genetic mutation or not. There was a recent study here not too long ago, a couple years ago, that 60% of the Hispanic population has this gene, and we don't know about it. There's no symptoms, there's no signs
Yeah.
to let us know that we actually do have this genetic mutation.
And
So,
not to interrupt, but just
hmm?
when you say genetic mutation, you're not talking about like forgive me, I'm the one that kind of asks the silly questions, right? But when you talk about genetic mutation, you're not talking about like you're part of the X-Men crew now, or you're a, you got Down syndrome or anything like that. This is like
Right.
when you say genetic mutation, what are kind of some symptoms of this 60% of the Hispanic population is kind of, dealing with?
Yeah, so the MTHR gene produces an enzyme that helps regulate homocysteine levels in the body. So when there's a mutation in this MTHFR gene, it's just a gene in your body,
Mm-hmm.
the body may not process the folate as well, which can lead to increased levels of homocysteine in the blood, which then turns into symptoms of depression, anxiety, the inability to focus and concentrate. So it's a lot of these mental health type
Wow.
Yeah.
symptoms.
So
And
it's not a physical deformity. I don't want to say mental
physiological.
deformity, but
Wow.
it's a mental,
Right.
yeah. Okay.
It's a physiological, I guess, genetic deformity that presents as mental health symptoms.
Okay.
And so, most doctors uh, don't know about this. It wasn't until here recently, probably about 9 years ago, that I learned about this MTHFR mutation and how it affects the mental health aspect of it. And it was just a trial and error, on people trying on different antidepressants and anxiolytics, and man, nothing's helping. What can this be? So I just dug more into it, and I said, maybe it's nutritional, and
Mm,
not just physiological. So that's when I found this out, and we started doing some testing. And sure enough, I gave them, just a supplement, which I use. It's called Enlight, Enlyte, Enlight. And it's a pre-metabolized, it's like brain food, basically.
okay. Where
So
can you get it, Doc?
it's prescription based only.
Okay.
So any, physician or practitioner can prescribe it. But if you look on their website, you could call in to them, and then they can find somebody to prescribe it for you. But anybody with Medicaid, Texas Medicaid right now can get it for free. So if you have Medicaid,
Perfect.
Love that.
it's a free, I don't like to call it medication. I call it a supplement, because that's all it is just a whole lot of vitamins that are pre-metabolized. So instead of, taking an over-the-counter, like some people will say, well, what's the difference between over-the-counter vitamin B complex versus the vitamin B complex that's found in Enlight? Well, the B complex that's found in Enlight's pre-metabolized, so you don't have those extra additives or flavors or colors, or none of those additives. It's just, that's what it is, and it's broken down already, so once you take it, it absorbs straight into the system.
Straight to the
Wow.
source, or
I
from
love
the
that.
source.
I love
So,
that you went on and you were kind of like you did the deep dive explore when you found out
yeah.
that there was something new. You wanted to better educate yourself, and then you kind of went down that path. And now the people that are benefiting are your patients, right?
Right.
And I do feel that, we were just talking about the food down in the valley, how I miss it, but I do feel that it is nutritional. There's
That's a good point.
stats and there's data about diabetes and in the valley, right? And again, it's not just the valley, but nutrition has to come into play where it's probably a huge factor in lifestyles and nutrition and just mental, I think that's
Right.
so fascinating.
Right. It plays a huge part. That was part of my doctorate thesis was, young children and adolescents with this MTHFR genetic mutation. And instead of, putting them on an antidepressant and something maybe for ADHD, you give them an Enlight once daily, one capsule, and their moods changed. The depression was no longer there. They were able to focus and concentrate in school. And it was all because of, lacking this nutritional, this value, daily value.
Now,
And
do you think, I mean, obviously some side effects of this Enlight, and we're not trying to promote a drug or, I mean,
No,
that's not what we're here
absolutely.
for. We're not promoting it. But do you see any side effects besides kids being awesome and being, like changing? Are there any negative side effects to, from your experience and what you've seen?
Yeah, I've been using this, and this is just one part. There's another one called Deplin, which is also, brain food or a prescription strength um, supplement, I'll say.
Mm-hmm.
But I just, by using both side to side or side by side, I've seen just so much more positive changes with the Enlight. It is way more affordable. And like I said, kids with, and even adults with Medicaid get it for free.
Mm-hmm.
You can give it, it's not age specific, so you can give it to 3-year-old kids. I've given it to a 3-year-old. I've given it to pregnant women. I've given it to the elderly, so it's safe across the board. There's absolutely no side effects that I've heard of. One side effect that this one particular person said was constipation. And I said,
Mm.
well, it might be the iron, now that your body's absorbing this folic acid that it wasn't used to it
That it's not
before.
used to in the first
That's
place. Yeah.
right. That
yeah.
that may be a problem. But she wasn't drinking a lot of, fluids either, so which is important.
Yeah.
So
But mhm.
So what we kind of just went over was a supplement, a lifestyle change. Those coupled together can help out with this mutation and the side effects or the symptoms of it. But is there any other type of like treatment plans that might be available, or is there like cognitive therapy that you need, or is these two things like the way to go?
Yeah, these two things, I mean, it's a start. Like I tell, most of my patients, medication, brain food supplements, think of it as, 60% of your health, your mental health.
Mm-hmm.
The other 40%, you have to give it your part, which is cognitive behavioral therapy or dialectic behavioral therapy, some type of, even if it's supportive therapy, just by talk therapy, it's
What
a
about exercise?
combination. Exercise, excellent, natural endorphins that are released, dopamine levels, serotonin, natural. It's all natural. So you
So
can't
it's a
go wrong
slippery
with
slope.
exercise.
Like, do you see a huge correlation in just people that maybe don't eat right, don't exercise, and then they kind of start to gradually kind of decline as far as the sky is falling? And I'm being a little facetious, but you start to see their mood and their outlook on things a little bit more negative than
Yes.
someone at their age that is kind of, that's a little bit more active and it's doing, things in a different way,
Right.
versus,
Right.
the other patients.
Exercise is, a huge plus, a huge part of positive, or mental health, well-being. Um, just being able, to see the difference in a patient that exercises, 3 to 5 times a day, 15, 20 minutes versus someone that's, pretty stagnant and, couch
Yeah.
potato that he doesn't want to do anything.
Yeah.
They are the ones that tend to be a little more irritable, mood swings, and the irritability comes from being lethargic, being just tired, of not being able to have that energy. Because once you exercise, it's natural energy that comes in, into
Yeah.
your body. So yeah, they may not be able to bend down and tie their shoes the way somebody that's, a little more fit can do. So that's where the irritability and depression starts coming from.
Wow.
Body, you know, dysmorphia. They start looking at their bodies,
Yeah.
and in a negative way.
Well, we've got about 8 more minutes left, but um where can people find you online, or like are you on social media? Like kind of plug yourself and your practice. Like how can
Yeah.
people get in touch with you if they're, if this kind of resonates with them and they want to talk to you, Dr. Hughes? Where can they find you?
Yeah, absolutely. I'm very, very transparent with my patients, and I think that's what sets me apart from the rest. I mean, I don't want to come in here with a huge head or anything, but if you go onto my website, my clinic name is Fig Tree, like the fruit Fig Tree Behavioral Wellness.
Okay.
And so the website is www.figtreebehavioral.com. And
Okay.
you'll see there that I'm very transparent with my own mental health. I suffer from depression and anxiety, and it started with postpartum depression. And that's
Mhm.
when I started thinking, you know what, I need to open up a clinic where I can relate to my patients, and I'm not just seeing a patient as a number, but an actual human being and a person, and how I would like to be treated. So that's how I run my clinic, is just very laid back, no scrubs, no white coat. And the office is set up just like a home. There's couches and, art. We
Love
we
that.
love art. And so I'm also on social media, on what is it, Facebook,
Okay.
Fig Tree Behavioral.
Yeah.
And so you can look us up, and we're here located in Harlingen, 956-230-8880. And we're here to help anybody that needs some help, even if you're not really sure and you just want to talk, and we can start that wheel turning and just talking. And I'm not all about medications. I'm actually about
Love that.
nutrition.
I'm so glad you said that.
That's
Yeah.
awesome.
Yeah,
I'm so
I
glad you
look
said
at it as a holistic approach first.
love that.
Yes, beautiful. I love
Yeah.
that. Medication should be the last resort, I think.
I
Exactly.
feel and I've seen therapists before in my day, but I feel like the biggest hurdle that someone has is getting the realization to themselves that they need to go and get help, right? I think
Right.
that's the
100%.
biggest obstacle, saying, "Hey, Matt, you're not doing great. You need to go see somebody, whether it's at Fig Tree Behavioral or not." Like, I think that is the biggest obstacle. Would you agree, Doc?
I would totally agree
So
completely.
how do you combat that? I mean, you could do, like, I'm in marketing, right? You could do all the marketing in the world, but if you how do you get past that hurdle and that obstacle of saying, it's okay to not be okay, come
Things
and
like Mind Split.
yeah,
Yeah, yeah, exactly. Things like Mind Split, and just educating the community through things like Mind Split, and
yeah,
educating them, letting them know that, hey, it's time to, bring this wall down and just crush this stigma. And it's okay to not be okay,
yeah,
because I'm a professional and I'm not okay sometimes. And I share that with, not only my patients, but also in my social media. I share my problems when I'm feeling down and depressed. I put it out there like, hey, today's a bad day, but it's okay because, blah, 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 blah. And so a lot of people can relate to that and say, you know what, I think it's time that I see somebody. I have tons of people that reach out to me through social media in Messenger, like, hey, I have a question. And, if that's the case, reach out to us in Messenger, and we'll be more than happy to. I'm the one that answers all the questions, so you'll get the
I love
answer
that. So
directly from me.
you're getting. I have one last question, and I don't, but it's top of mind.
Sure.
What are some of the, getting that personal, like, hey, I need to get over this obstacle, I need to go see somebody. But as far as family members, can you give maybe, 2 or 3 kind of like flags for like a family member of a loved one that you can kind of help point them in the direction, like, hey, if you see 2 or, one of these or 2 of these, kind of flags for your loved one, maybe it's time you start kind of trying to talk to them about going to Fig Tree or another, psychiatrist.
Yeah, any mental health provider. Yeah, absolutely. If you see, your loved one as a little more reserved, maybe spending more time in the room by themselves, not really socializing or talking, you notice a decrease in appetite or an increase in appetite. You notice that they're not coming out to eat, dinner with you. I have a lot of adolescents that once they hit this hormonal age, that depression sets in and they don't know which way to go. They're trying to find who they are themselves.
Yeah.
And so you see that, reach out. I'll be more than happy to, spend, an hour or so and just talking to your loved one about, how important communication is, because that's
Love that.
where it starts.
Yep. I love that.
Absolutely.
Yeah. And are you private pay? Do you take insurance? Like, what is Fig Tree Behavioral Wellness?
We take a multitude of insurance. I'm on most of insurance panels.
Okay.
Very flexible, and so we also do private pay. A lot of professionals do not want to use their insurance, to flag them as a mental health,
Yeah.
visit.
Yeah.
So I do a lot of private pay as well.
Yeah.
So there's
can
no
imagine
reason not to go see you when you're in need. You can accept private pay and most insurance.
Yeah.
No reason.
Exactly. No reason.
Yeah. Okay. Well, Dr. Hughes, thank you so much for joining the show this week. This has been so informational. I'm sitting here listening to you talk, and I'm thinking about, like, man, maybe I need to go see somebody, because
Right.
I've got like 9 of the flags, and you only gave 3 of them, right? So I kid. I'm just being funny, but I thank you so much for being a part of the show and lending your time and your expertise.
Yes, thank you for the invite. And I'm, a big advocate for, community education. So anytime, I'd love to be back.
Yeah, absolutely. We might need to get you on a round table with a couple other clinicians there in the Valley. That'd be an interesting one.
That would be really cool.
Yes.
That would be any way we can connect everybody in the, in the industry. I think that would be awesome. So,
Absolutely.
Doc, you are a friend of the show, and we love you, and we appreciate you very much.
Yes,
I
ma'am.
appreciate you guys. Thank you so much.
I'll send you and your husband my address off air so y'all can send me
Oh,
some
we'll
food,
send you some enchiladas.
I need some brain food, Doc. I need some brain food, okay? So
we'll send you some enchiladas and tacos.
Oh, I love it. I love it. Till next week, guys. Take care.
See you next week.
Bye-bye.